Greetings and welcome from the Science of Massage Institute. My name is Dr. Rostur Chininov, and I represent here teachers, therapists, and supporting staff of SOMI. We work tirelessly with massage therapy community, helping therapists to become clinically effective and efficient medical massage practitioners. At the same time, we work with medical community, trying to educate physicians, chiropractors, physical therapists, and clinical benefits of massage therapy, and so far we had great successes in both directions. I don't want to take your time and describe my personal bio. It's accessible to everyone on our main educational website, scienceofmassage.com/editorial board. But I would like to say that for the last 30 years I was actively involved in the scientific research, clinical application, as well as educational projects associated with medical massage therapy. I published more than 100 articles in medical and massage therapy publications around the world, as well as 3 major textbooks. What we decided to do here in SOMI, we decided to make a series of short videos to explain therapists what medical massage actually is. I'm perfectly aware that what I will say may contradict some personal views, experiences, or even way how people practice medical massage therapy. But I will do it exactly the same way as my teachers taught me in the medical school and later in residency how to prescribe and practice medical massage therapy. Exactly the same way I teach my students now and taught before, as well as my colleagues teaching students around the world for the last 30 years. So let's dig some massage science together. Before discussing medical massage and its clinical potentials, we need to define how medical massage is different from other types of massage therapy. During our videos, I will use a lot of everyday as well as medical analogies to better present discussed topics.
We can clearly see that Western School of Massage Therapy has 3 branches: sports massage, preventive massage therapy, and medical massage. In the first video, we will concentrate on sports massage and preventive massage, and we will discuss medical massage in the video number 2. So, let's concentrate right now on the sports massage and how it's different from the medical massage application. Modern history of sports massage starts in 1924 Olympic Games in Paris. The legendary Finnish runner Paavo Nurmi won so many medals that year that he was nicknamed as a Flying Finn. Nurmi was first world-class athlete who brought massage therapists to the competition and also credited massage therapy for his unsurpassed sports achievement. History even saved picture of him before getting post-event massage.
You definitely read, participated in the class, or once were taught how to apply sports massage to the injured shoulder, how to address sprained ankle joint or pain in the leg due to the compartment syndrome, and so on and so on. All of that is completely incorrect presentation of real sports massage idea and practice. Sports massage doesn't have clinical teeth. When it's done correctly, it is challenging but beautiful and effective technical application which has only 2 goals. Number 1, to prevent injury and overload. Number 2, while being part of the training process, sports massage helps to the athlete or to the sport enthusiast achieve peak of the performance. Technically speaking, it becomes part of the training process. And that's it, nothing else. As soon as injury happens, sports massage therapists need to have a switch in his or her head to completely change technical application, approaches, modality, and now to fix the problem instead of preventing that from happening. Let me illustrate this concept with a very simple analogy.
Runner injured his Achilles tendon, and he suddenly felt acute pain and now he limps. At the same time, Old lady slipped on the floor in the supermarket and also damaged her Achilles tendon, and now she exhibits exactly same symptoms as the injured athlete.
What you just saw are exactly two same injuries which just happened in a different setting. Damaged Achilles tendon should be treated with exactly same protocol, of course with individual adjustments when they need it. Let's follow the basic logic. If in this case treatment we call sports massage, then in this case treatment should be called supermarket massage. It is professional mistake to define injury and the way how to address it by the place where injury happened.
Let's now look on preventive role of massage therapy. As you can see, we split preventive application of massage therapy into subdivisions. Stress reduction massage, which has more relaxing and even spiritual aspects, and therapeutic massage, which uses more sophisticated set of techniques and has more profound impact on autonomic nervous system.
Consciously, we can control very limited number of body functions. Yes, we can run, we can swallow, in some degree increase respiratory rate, but we cannot alter our heart rate, we cannot increase oxygenation of the fascia, all of that under control of so-called autonomic nervous system, which has two divisions, sympathetic and parasympathetic divisions, and they're both working to maintain our basic body functions independently from our conscious decisions.
Autonomic nervous system consists from two divisions. Sympathetic division, which also called fight and flight, and it's active during the day, and parasympathetic division, which also called rest and digest, and it's more active during the night.
Both divisions of autonomic nervous system must work in perfect balance to maintain us in healthy state. Let me illustrate their healthy interactions on very simple everyday example. Let's say that you are approaching the bus stop and suddenly you see that it appears around the corner and you're afraid that you maybe miss the bus. So you start to run. As soon as you start to run, your respiratory rate increases, your heart rate increases, your muscles start to work more efficiently. It means that sympathetic nervous system start to dramatically increase its function, or how it's called, sympathetic tone. Now it allowed you to get to the bus, and now you are sitting and you're riding to your destination. If there is no balance between two systems, then you will continue to have increased respiratory and heart rate for another maybe hour or two. But in several seconds, it starts to immediately go down, and then in a minute or two, you again breathing normally and your heart rate is normal again. So what happened actually, your parasympathetic nervous system start to increase its activity, and that suppresses sympathetic nervous system. So they constantly watching each other, and they are interactions which supposed to equal zero, equal our healthy state.
Professor Selye from Canada was first scientist who experimentally proved that chronic accumulation of stress and disbalance between both divisions of autonomic nervous system is destructive to the human body. Thanks to his work, the modern medicine sees this disbalance as a first stepping stone in formation of majority of chronic abnormalities, except trauma, infections, and environmental triggers.
If this balance between both systems is small, it can be easily controlled by going to the gym, taking yoga classes, or water aerobic classes. Full body massage sessions are irreplaceable tool to help maintain balance between both systems or address disbalance if the gap between both systems is small. Technically speaking, full body massage sessions filling up so-called touch gap, which we all experience in our touch-deprived society. You know that all newborn babies have all five senses already fully developed in them, but they heavily rely on touch receptors. because first of all, they're used by mothers to calm the babies. And secondarily, slightly later in life, babies start to explore world around them, heavily relying on touch receptors. So we can say that touch as a sense and early stages of our development, one of the major contributors to the development of the brain. So while giving client full body massage, the therapist addresses peripheral receptors located in the soft tissue, and by working on them, he or she alters function of central nervous system, including addressing balance within autonomic nervous system. But again, it can be done only if the gap between both systems is small. As soon as gap is large, full body massage doesn't have enough clinical tools, not only to restore balance, but address reflexes which were broken as a result of disbalance. And that's completely different practice. Because right now, it's not only a matter of balance between activity of both systems, entire system needs to be reset. And that can be done using peripheral receptors as a tool, but they need to be addressed correctly. Let me give you following analogy.
I can compare the significant disbalance within autonomic nervous system with the rock fall. When first stone falls down from its place on the top of the slope, it always takes down other stones until it becomes full rockfall. Same exact thing happens in our body when the initial trigger in form of disbalance within autonomic nervous system or first stone becomes hidden behind newly developed massive clinical events.
For example, therapist works on two clients, one with cluster headache around the left eye, and the second with irritable bowel syndrome. In both scenarios, the initial disbalance between sympathetic and parasympathetic nervous system was the trigger. In case of first client, increase in sympathetic tone triggered tension and active trigger point formation in posterior cervical muscles. They mildly irritated greater occipital nerve, which in turn triggered tension in scalp, and then trigeminal occipital convergence, which gave patient debilitating cluster headache. In the second scenario, initial disbalance between both systems triggered purely localized chronic abdominal pain with constipation. With time, it fully progressed in irritable bowel syndrome. So, the health practitioners deal with a variety of somatic and visceral abnormalities, while at the very beginning, the incorrect activity of autonomic nervous system was initial trigger. Let's come back to our rockfall analogy.
Right now, we face consequence of the rockfall since loose stones blocking the road. This blockage can be in form of the cluster headache or in the form of irritable bowel syndrome.
Can full body massage session help these patients? Definitely it will take edge of the symptoms intensity, because full body massage session work as some kind of grader to clean the road by pushing stones to the roadside. The problem is stones continue to fall from the slope, and now therapy becomes endless chase of our own tail. Let's look on the therapy from the medical massage perspective using same analogy. In the difference with full body massage, medical massage practitioner will take each stone and place it back on the slope where it was originally located. While doing so, therapist will fix the problem, but what more important, it will reset and restore normal relationship, reflex relationship, between both division of autonomic nervous system. And in such case, therapist doing that by using peripheral receptors in the soft tissue as a major rewiring tool. To summarize first video, at some point, injured athlete in case of sports massage, or client in pain in case of preventive role of massage therapy, they become patients, and they now transfer it under umbrella of medical massage. This is the end of our first video. In the following videos, we will discuss importance of medical massage for the modern medicine. Using same analogy, we will also illustrate how medical massage practitioners are able to address somatic abnormalities by placing individual's rock back on the slope. So stay tuned and thank you for watching.